You are listening to the Toxic Mold Podcast with my husband, Steve Worsley, the toxic mold expert and your number one source for mold consulting and mitigation in the USA. Here is episode 169, How to Determine if you have toxic mold mycotoxins in your body.
Before we get started on this episode, a short or not so short disclaimer. While all attempts have been made to verify the content provided in this podcast, neither the podcaster or the producers assume any responsibility for errors, omissions, or alternative interpretations of the issues discussed herein. All information stated in this podcast is the opinion of Steve Worsley. Steve Worsley is a mold specialist with over 20 years of experience in the construction and mold industry. The Toxic Mold Podcast is for information sharing purposes only. The views expressed are those of the podcaster and his alone. These views should not be taken as expert instruction or commands. While there may be references to medical conditions and symptoms, all solo podcast episodes are the opinion of Steve Worsley, and any medical questions or concerns shall be addressed with the appropriate licensed medical professional or professionals. As the podcaster refers to different mold types, please be aware that Steve Worsley is not a microbiologist, and questions concerning mold specifics should be answered by the appropriate professional. The listener is 100% responsible for his or her own actions. You can check out Steve's books on Amazon about mold and dealing with mold in your home at amazon.com/author/Steve Worsley. And if you're interested in scheduling a mold consultation, over the phone consultation with Steve, you can be sure to find out more about those and his availability at cnccontractorservices.com. Now, let's get to the episode. Hello, everybody. Welcome to a brand new episode of the Toxic Mold Podcast. Steve, today we are talking about mycotoxins and how to figure out if they're in your body. So first of all, what is a mycotoxin?
It's what's produced from mold entering the body, whether it's inhaled, eaten, comes in through a wound. Those molds can produce mycotoxins, which obviously it's a toxin to your body, so it starts attacking the body just like any other disease would.
And so what's the first step to somebody recognizing whether or not they have mycotoxins in there?
You would have to recognize the mold sickness symptoms. Okay. So, we talk about it all the time, like, is it just allergies? Is this, am I sick because of COVID? Am I sick because of the common flu or whatever? So you would have to recognize that you have the sickness, meaning runny nose, watery eyes, fatigue, irritability,
which could be so many other things. So how do you get from it's how people go on WebMD and they're like, man, I think I have 50 different diseases with these symptoms. How do you start to get to the real root of, is this because of mold?
Well, first and foremost, you obviously would have to go to your doctor, and that's a whole other podcast as to what doctors and what they're supposed to do, but that's not my expertise. But I guess what I mean by that's a whole other podcast is you, for the most part, if you're going to your GP, and I'm not saying they're not educated by any means, but they're probably not well-versed in mold sickness. You would have to get them to say it could be, mold exposure, and most of them probably wouldn't unless you push them, if that makes sense. They're probably just going to say, well, there's the common flu going around. There's a stomach virus going around.
But this is why I think you have to be a difficult patient. I enjoy being a difficult patient.
Yeah,
because
that's one thing I've learned.
You need to be an advocate for your own health,
and
you need to research the doctors, and I don't care how much you like them. If they don't believe in mold sickness, fire them. B, if they don't have any experience with dealing with patients who've had mold sickness, fire them. And C, if they can't explore with you the things you want to test and are saying, no, you don't need that test, fire them. You need a doctor who actually understands mold, believes that mold sickness is a real thing, has worked with patients before, and if they don't know what to test, they will send you to a specialist who will.
Exactly. And I wouldn't expect your GP to know all this. So and I know you weren't saying that, like, don't fire your GP because they don't know about mold. But once you go to that specialist, exactly, don't waste your time or your money. And
I am saying fire your GP if you go to your GP and you say,
and they poo-poo
I think
mold.
I have
Yeah,
mold,
I
and your
agree.
GP says to you, no, it's just probably, it's allergy season, you're getting older.
Mold's natural.
I don't care how much you like them, fire them.
Yeah. If you don't believe in mold sickness, just Google it and you'll see how many people actually suffered from it, not for it. One thing we mentioned, it's been several weeks ago, a lot, we're in a day and age where there are so many sicknesses out there. Some of them are very difficult to diagnose, and some are simple. And for me, mold exposure, mold sickness, if you get a mold specialist as far as my side of mold specialty, the construction side of it, and you have a doctor that does the same thing, you can pretty easily tell if it's mold sickness. But a lot of times, it's misdiagnosed, and the most common one that I see is Lyme's disease.
Yeah.
Mold sickness, and people can call it whatever they want to call it, but mold toxicity in your body is all the things are very are similar to Lyme's disease. Mm-hmm. Now, how would you differentiate the two? On the medical side, I have no idea. But I can tell you we can do blood work and urine testing and come into your home, do a visual inspection, run mold tests, meaning mold tests on the home itself. So you can do air testing, swab samples, whatever there. Once you could gather all that, I guarantee you we can tell the difference between was it from a tick or is it mold in your home. Does that make sense?
Yeah,
and I kind of went through it quickly, but a lot of times, going back to the doctors, a lot of times it's just misdiagnosed.
Correct. And isn't this also an issue of people need to document and journal their symptoms, where they're experiencing them, under what you've got to be able to go to any doctor, whether they believe in mold or not, with your documentation.
Exactly. Yep. It's no different than, I had that medical procedure several weeks ago now, or a month or so ago. I couldn't just go to the surgeon and say, well, sometimes I hurt here, but I don't know. It's just, sometimes I just don't feel well. They're going to look at you and laugh. And just like with the mold side, that doctor said, okay, we need to do this, this, and this. And then they got to the bottom of what was wrong. Like, okay, you have a gallbladder that's not working.
Right.
But you can't go to the doctor and just say, I just don't really feel well. Like, he's going to look at you like, so you want me to do the job that you should have been doing. Now, if you want to pay that doctor, what do they charge you? $300 for a 10-minute visit? If you want to pay them the kind of money, $2,000 an hour, to do all your legwork, have fun with that. But you do need that journal.
Absolutely. And you need to be vigilant about documenting over a longer period of time, at least 3 months, maybe longer, but you need to be able to go to them with something that shows a history.
Exactly. And it's no different than when I do a consultation, and I haven't encountered this yet. I can't help you as my client if you can't give me information. If I ask you, well, what kind of symptoms are you experiencing? Well, I don't know. When did it start? Well, I don't know. Was there a moisture intrusion event? I don't know. Well, I don't know either. I mean,
exactly.
I can only diagnose based on the information you're giving me. I can't do all the work. I can do the air testing. I can do the visual inspection. But if you're not giving me information about what you've experienced, I only have a limited amount of things that I can come up with a diagnosis. And the doctor is the same way.
Correct. Very much the same way.
And I'm not trying to compare myself to a doctor, but very similar.
But information has to be given in order for any specialist to decide what should be the next step in the whole process. I mean, you can't just go into the doctor and he says, well, what am I seeing you for? And you say, well, I think I got mold exposure and I have mycotoxins. And they're going to be like, well, who told you that? Well, this Steve guy that I listen to his podcast, they're going to think I'm an idiot if you don't have anything else to tell them. Well, and in the same note, if you go to a doctor and you say, I have brain fog, dizziness, I'm tired all the time, I have anxiety and depression that I've never had before, and I just moved into a home that we figured out had lots of mold in it, and we've been there for 6 months, and your doctor looks at you and goes, well, I think maybe you need to go see a different person, maybe get an antidepressant, and your doctor hasn't even mentioned doing blood or urine testing.
Right.
Fire that doctor.
Exactly.
Usually, from a patient's perspective, blood and urine testing should be one of the first things you do.
Right.
And if your doctor isn't even willing to do the baseline things to help you get a baseline on where your health is at this moment, that is problematic.
Right. Yeah, and all you're doing is treating the symptoms. You're not getting down to the root cause. And, going back to what we were talking about earlier, like a surgeon just doesn't go in and remove a gallbladder.
Correct.
They have to put everything together and say, okay, why are we doing this? And, if you go into your doctor and all they say is, well, here's a pharmaceutical pill that you can take, it might make you feel better, but everybody else in the home that's sick, so you're going to put your whole family on antidepressants?
Exactly.
I mean, you need to get down to the bottom of what's causing it.
Correct.
And that's where CNC Contractor Services, that's where we have branched out to an area where I don't know anybody, and our listeners might know, but I don't know of any other company that does what we do.
Correct.
And it's because we don't just, say we're just going to do mold mitigation, or we're just going to run air testing and say, well, it looked fine. Well, every home, every client is always different. And we literally write the book based on that person. We don't just say, we're going to just do this. Like your doctor says, well, I'm just going to give you an antidepressant.
Yeah, no.
Because they're not doing you any good.
No, they're not. And again, it's more like a CSI investigation than anything else. And it's got to be personalized to the dynamics that are going on in your situation.
Right. Yeah, and I deal with clients, most of the clients I deal with, whether it's consultations, VPAs, people on site, they have had, either blood work, urine work done for mycotoxin testing. They've had air testing done. They've had mold mitigation done, and they still can't get to the bottom of it. And a lot of it is because, our competitors, they just say, oh, well, the air tests look fine. Well, that's not how mold works. There's no pass or fail to those air tests. It's no different than, if you were to do mycotoxin testing, they're going to come back just like all blood work with a range of what, you should be. And if you're over that, they're going to, it's a red flag. But there are things where you could be in the normal range, but maybe you're allergic to a certain mold type, which, is going back to we talked about peanuts before. Some people can eat peanuts till their mouth is sore. Other people can't even be around peanuts because they're so allergic.
Correct.
So what could be deemed as normal isn't always normal. Does that make sense?
Yeah. That's very, very true. So at the end of the day, determining if somebody has mycotoxins in their body really requires a comprehensive look at every place that they go, not just home, work.
Yep.
What their habits are, what they're exposing themselves to, and how often. Yeah,
and that's where the journal comes in handy, because just because you're experiencing mold sickness doesn't mean your home is where it is. Yep. It could be in the school you're going to. It could be at the workplace. So, you got to keep that in mind. And, going back to the blood work and urine testing, there are labs, and I'm not affiliated with any of them. I don't endorse any of them. I don't know if you need a recommendation. I know there are some labs that you can just call and get the test kits, and it is expensive. But there are several labs we have right here in America that you can use. And, like the ones that I've dealt with as far as, clients I've dealt with is LabCorp, Great Plains Lab, mymycolab.com, and Sunrise Clinic. So for our listeners, there's, go Google those. And some are urine tests, some are blood tests. And, talk with your doctor. Obviously, you have to have a doctor involved on the medical side. And then obviously you need somebody involved on what I call our side, the blue collar side, the home side of things, to get to the bottom of it.
And really what you need is a partnership between the two sides.
Yes.
You've got to have And if you're the middle person, which you probably will be, but you've got to have a mold specialist who knows what they're doing, a doctor who knows what they're doing, and both those sides are testing in their arena of specialty and helping you put together all the information.
Right. Yep. And it's, you're not going to, your mold specialist and the doctor aren't always going to agree.
Correct.
And, it's not who knows more, who's smarter, who's right, who's wrong. You do, like you said, have to work together and say, okay, here's what Steve recommends or the mold specialist recommends. If your doctor's going to be like, well, I don't care what he thinks, then you're wasting your time and money with this mold specialist. And, if you trust your doctor more, then go that route.
Exactly.
But, if you just want the antidepressants to fix it, then you can go that route. But you're not helping the rest of the occupants of your home.
Correct.
So you're exposing them to the same stuff you're exposed to.
Exactly. And at the end of the day, you want to fix the problem at the root.
Yep. Yeah, we want to figure out, is it that you're allergic to a mold type and your home's fine? Or is there, a bunch of mold in your home that's causing it?
Correct.
We want to get to the bottom of it.
100%. So what is your call to action for people?
Don't ignore if whatever symptoms you're having, don't poo-poo it away and go, well, it's probably just the common cold or allergies. Make sure you recognize that you're sick, just like we talked about right at the beginning. And like you said, make sure you have a journal, write it down, put it in your notes app on your phone. Do something to record all the stuff you're experiencing.
Exactly. Well, you heard it from the expert. And if you want support and help in figuring out how to do this CSI investigation from a mold perspective, go to CNC Contractor Services because you've got a variety of consultations on there that they can opt in, sign up for, schedule, and get in and really figure out what for their specific situation do they need to start taking some action on.
Yeah, and they can reach out to me. We've said this before. If you reach out to us either through the website or my email, make sure you monitor your junk folder because a lot of times, for some reason, that's where it ends up. But shoot us an email, and I could tell you should do a VPA or we should do a consultation. I'll tell you which direction we should start with. I'm not gonna make you go through every step. We can skip a few and we can, get to the bottom of what's going on.
Absolutely. So learn more, cnccontractorservices.com. We'll catch you on the next episode.
Prevent toxic mold exposure before it gets in your home. Download Steve's free mold investigation checklist at tinyurl.com/CNC mold checklist. Again, download Steve's free mold investigation checklist at tinyurl.com/CNC mold checklist.